I understand the part about spending federal relief.
All right, it's 9 o'clock. And it is time to get moving here. I forgot to turn on the recorder. I want to do that right now. It's Wednesday the 12th. The 12th of, it doesn't look like it. That's right, because the tower's down. All right, that takes care of that. All right, let's get back to what else is going on here. Good morning to the Breaking Health Barriers. I'm Dr. Jack Stockwell, and I will be here for 2 hours this morning. Trying to give you some good understanding regarding the health of the body and the indisputable fact that the vast majority of what we're suffering from today in the Western world, not just here, but in the West in general, countries that have grocery stores, what we're suffering from is just simply massive malnutrition. That's hard to imagine that. It's hard to imagine where half of our population is overweight and that we're malnourished. By malnourished, I don't mean that we're not getting enough food. We're certainly getting enough. We can see that. What I mean by malnourished is that you're not getting the critical nourishment, especially micronourishment, that the organs of the body require, which is why you see a proliferation of diseases today we did not see 100 years ago. And it's not because some laboratory in China is releasing all these different viruses that suddenly make all these new diseases, the lupus and all the autoimmune stuff. And every time you turn around, there's some new drug being advertised on TV that would make you think that you're under an ocean of attack from various types of microbes, that you don't have a choice, or you don't have a chance, you don't have a choice. You just have to fall in line with the medical myths and sign up as a lifetime membership to the club. I am 75 now, and I am quite happy with the fact that I have a prescription, one prescription for my prostate that I take occasionally. I don't take it all the time, just when I feel like I need it. But that's it. I don't take anything for my heart. I don't take anything for my brain, which is probably obvious to you. My biggest fear about my brain is I'm going to start repeating things, and I'm not going to be aware of it. And some patient's going to look at me weird, or family member or something, and they're finally going to say, Dr. Jack, you realize you just repeated yourself 3 times in the last 2 minutes? Oh. That's my biggest fear. I know where I live. I know how to get to work. I know what to do when I get there. But I take an awful lot of things from my brain. Last week I was talking about flax seed and B6. I take 4 of those every morning. I just had my breakfast. My breakfast consists of supplements. You'll probably think I'm crazy, but I counted them this morning, 62. Between pills and capsules, 62. And my belly's full. But I'm also full of all the micronutrition that my body requires. And so when I take care of people who are my age and older, I can tell the ones who are taking care of themselves, food-wise, supplement-wise. I can tell the ones that grew up on a farm and drank raw milk and ate the vegetables and the animals that were on their farm, and didn't suffer the curse of having to buy grocery foods, the foods of commerce, as Dr. Price referred to them as. The foods of commerce. Anytime the foods of commerce were introduced into a society where they had not existed before, within one generation, sometimes 2 generations, heart disease, diabetes, arthritis, just everywhere you turned, cancer, all started showing up. And it's not that the so much that the foods of commerce contained the seeds of these diseases. The foods of commerce had what their bodies needed for resilient strength against the onset of diseases was missing from the food. And so they were slowly starving themselves into sickness. Now, I have been talking about the heart lately. I'm going to talk about the heart some more today, different aspects of it, because this is the number one killer in America. And most of the people who experience their first heart attack are within a week or so in their funerals and buried in the ground because they don't survive it. And those that do survive a heart attack, depending on how severe it is, probably only have half of their life left, half of life's expression. And it depends on how fast emergency care was administered. And again, I used the case of my brother, who literally dropped dead a few months ago on the green in a golf match. He's back on the green. He has some weakness. He has some. He can feel a little slower, but due to the fact that he's got some machines in his chest now, his defibrillator and his pacemaker, and then quite a bit of drugs that he's taking. But as he goes through the steps of post-cardiac emergency surgery, each succeeding test and exam shows that he's better off from a medical point of view. Now, unless or until he decides to feed his heart micronutrition, it's still a downward path. It's just that modern medicine saved his life. Now, if that were to happen to me, boy, I'd want to be in the nearest emergency room as soon as possible. There's no doubt about it. But what happens after the emergency room, what you might add to your post-cardiac care can actually give you a new heart. You don't have to have a heart transplant. No organ in the body responds faster to improved nutrition than does the heart. And no organ in the body suffers quicker from bad nutrition than does the heart. And we get all the symptoms, we get all the signs and symptoms. Lower extremities start to swell. We start to retain fluid because the heart isn't powerful enough to pump it back out. You have more vessels in your body to move lymph than you have vessels to move blood. Anatomists tell us we have about 60,000 miles of blood vessels inside of us. I mean, that's a little more than twice around the middle of the earth. And but we have even more lymphatic vessels to keep moving lymph. And lymph is this fluid that passes in and around cells, constantly cleaning, debriding, detoxifying, carrying this vital fluid throughout the body so that fat-soluble materials will end up in the bile and out through the colon, and water-soluble materials will end up in the urine and out the body that way, so that you have constant cleaning taking place of the cells of the body. But that's not enough. Just like exercise isn't enough. I told you about this lady who I think I'll either be seeing today or Friday for follow-up care, mid-30s. And she could be a cover girl for a woman's workout health fitness magazine. Just looks as fit a human being as I've ever seen. But she's fatigued. She has this tremendous fatigue. And her diet does not support extra strength and resilience. We had a chat about that. Vegetarian that leans towards veganism. And I tried to explain why you're not going to get any energy out of that. And But I told her I want to do a heart scan. Let me do a heart scan. We've got this incredible device. It only takes a few minutes, but it will listen to your heart, and listening to your heart will interpret the strength of the heart and the valves and indicate if there's a problem. Boy, did it ever. You wouldn't know looking at her that she had a heart problem. She didn't know she had a heart problem. And then we checked her for her adrenals. There's an easy check for adrenal strength. I've talked to patients who come to us that are on heart medications, and as we go over their history, I said, what did they tell you about your adrenal glands? And they said, they usually say the same thing. We never discussed the adrenal glands. I said, you're a heart patient, you're on heart medications, and they never talked to you about your adrenals? So we tested her adrenals. And it's a very simple test. It's called Ragland's test. You put a blood pressure cuff on the arm when someone is laying supine, which means they're on their back looking upward, and you do their blood pressure. And then you leave the cuff on the arm and then have them stand up and do an immediate blood pressure check again. And what should happen is the systolic pressure, the high number, should jump up at least 10 points. Why is it doing that? Because as soon as the brain is vertical from a laying down position, hormones are released from the adrenals to increase blood pressure so that when you stand up, the blood doesn't drain out of your head, that it keeps a sufficient amount of blood flowing through your brain. Well, we did that with her, and not only did it not go up 10 points, it dropped 10 points when she stood up. Bingo! How much did that test cost? I mean, compared to medical testing. And they didn't even test her adrenals. It's just simple little tests like that. So we put her on some adrenal supporting supplements, heart supporting supplements, and we ought to be seeing her here certainly before Thanksgiving for a follow-up to see how her heart is responding, as well as her adrenal glands. And the first thing I'm going to say when I see her is, how are your energy levels? And I know what she's going to say, 9 times out of 10. Better. How's the fatigue? It's getting better. And what did we do? Food specific for the heart and for the adrenal glands. So, this week is the anniversary of one of my mentors, and a man that was as close to me as any of my brothers, who taught me an awful lot about the spine and how to fix it and how to get people out of pain. He died a year ago this week from a massive cardiac failure. And to look at him, you wouldn't think there was any problem at all. If anything, he might be a hair underweight. And active in golf, active in running 2 to 3 different businesses, very much involved with the NUCA organization that I'm a part of. One of the leaders, one of the pillars of the organization. And he came to me 2 days before he passed away. And this was in Minneapolis a year ago. And he said to me, he says, Jack, I think I had a heart attack last night. Now, I've told this story before, but I need to tell it again because of its relevance. He said, I think I had a heart attack last night. Well, tell me what happened. Describe. And what he described sounded like a cardiac event. And I said, well, maybe we better get over to the ER. No, I'll get it checked when I go home. And so he left, maybe an hour later after we spent some time together, just the two of us. And then he got on the shuttle at the hotel to the airport and was gone. 2 days later, drops dead in his driveway, blowing leaves. And as I was able to talk to family members over the ensuing year, right up until this last conference a couple of weeks ago in Minneapolis, the fall conference. A family member told me that wasn't his first sign. He's had several of them. And every time something like this took place, we called EMTs, they showed up, but he was back up on his feet, he was moving around, his vitals were restored, and he would not go to the hospital. He just brushed it off and said, I'll get it checked. I told him about my heart sound recorder, the machine that I use in my office with my patients to measure heart function and to see if there's a problem ensuing that's hiding in the shadows. And he kept saying, yeah, I got to get up there from Phoenix. He had moved his office from Chicago to Phoenix. He says, yeah, I've got to get up there. And so many times I thought, I'm just going to jump, I'll grab my laptop and the heart sound recorder, get on a plane, go down there and test his heart where he's at. Oh, I never got around to that any more than he got around to coming up and letting me check it. Now, he's not around for me to check it. And interestingly enough, almost every cardiac coronary artery was pretty well plugged up. He didn't have a chance. Now, what caused that? Things that he was eating and things that he wasn't eating that didn't allow the heart to take care of itself, and at the same time, ate particular food. Both his parents outlived him by, I think, almost 2 decades each, lived longer than he did. Well, anyway, I miss him. Now, except for those with heart disease or those at the highest risk for heart disease, all the standard medical risk factors add up to almost nothing when it comes to predicting heart disease or heart attack or stroke. And for healthy adults, even the alternative risk factors like homocysteine or cardiac C-reactive proteins are practically useless. And this is important to know since so many multiple risk factors involving heart function
October. And ready to go in here.
Well, hold on a second. How is that playing? How is that playing? I'm sorry, those of you on the stream, that there's something playing at K-Talk. There we go. What the heck is that? I guess I'll play something new. I think I heard you call in, but I can't hear you. Isn't your medical show today? The recording computer is playing nothing. Where are you connected with Zoom? Should I play something? I'll give a couple more. You're down to only 25 people. 25 people trying to listen. Okay, I guess I'll play something now. All right, let's try this and see if this works. This should make a difference. Sorry about that. Down to 25 people. We've got tower problems, and we're trying to figure out those tower problems. And I tried to reconnect here with the K-Talk audience. Hopefully I'm doing so. The stream is kind of thin. The K-Talk audience is thin. And so one kind of wonders, do you want to do this? Yeah, I want to do this. Gosh, if I could just save one more life. Because we've been able to turn so many lives around now by feeding the heart exactly what it needs. Those of you who are still listening, and I'm sorry, Paul, I had my thing turned off here. I didn't realize you had been trying to connect here. I'm connected now. I believe I'm connected now. You might send me a text to let me know. While we're limping through this period at K-Talk, while we're trying to fix tower issues. And we'll get it done. K-Talk will survive. We'll get it done. Those of you just tuning in, I see several of you are. I'm Dr. Jack Stockwell at ForbiddenDoctor.com. Also, JackStockwell.com. Talks about NUCA and what I do structurally for the body. And we decided to extend our 2-for-1 special from now till the end of December. And what I usually charge to take care of somebody, we just slashed it in half. We usually do this every Christmas season. People, the grocery store I shop at, Harmon's is already full of Christmas stuff, so we're Christmassy too. Anyway, I've been talking about the heart, and I was talking about a dear friend of mine who this week is the 1-year anniversary of his passing from a massive heart attack. And to look at him, you would not think this was a heart disease candidate. Nice and trim. I'm not going to, for those who heard me explain this in the first half hour, I'm not going to repeat the whole thing. Just to look at him, you would know there's a problem. Until, of course, it hits, and then he's dead. And then I was talking about this lady that we started taking care of, who's come into us for extreme fatigue. But she works out, and she runs, she lifts weights, she runs a family of several children. She's in her mid-30s. And to look at her physically, this is a woman you would expect to see on the cover of a woman's magazine for health, nutrition, and fitness, because she seems to be the embodiment of that, except she can't get off the couch. And if she sits still long enough, she falls asleep. Well, part of the problem is her diet, because it's vegetarian, leaning towards vegan. And I must have talked to her about a half an hour before I started to get through the clouds for her to listen to me. But then I said, we need to do a heart test. We need to do a heart scan. I want to see how your heart's functioning. It was extremely weak. She's in her mid-30s, and she has weak heart response. And then we checked her adrenals that were almost shut off. Quick, easy test, non-invasive. Tells me what your heart's doing and what your adrenal glands are doing. And if your heart isn't functioning up to optimum levels, as well as your adrenal glands, you're going to be suffering. And you're just getting in line for the next drop-dead heart attack. So I talk to my patients like this. I tell them right up front, do you want me to sugarcoat this, or you want me to tell you the truth? But I can make it sound easy and nice, or I can tell you that you're headed for disaster. Here, it's right here on the screen. You're missing beats, and in some other places you have extra beats. You're not supposed to have an extra beat. Your heart, it should be lub-dub, 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 not lub-dub-dub, or lub-dub, 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 lub-dub. It's supposed to be lub-dub, 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 a strong lub, half a strong dub. And it's right here on the screen. Let me show you how your heart looks in real time. But you can't feel it. But when we were testing her, she said, oh, I can feel my heart. I said, what do you mean? I can feel it bounce around. I said, you kind of laugh when somebody says that. Well, it's funny, but you're not supposed to feel your heart. You feel your heart because your heart's struggling to get oxygen to the brain. Why is it struggling? Because it's weak. You ever tried to lift something up over your head onto a shelf or pick up something that was heavier than you should be lifting, and you grunt and you groan, and as you're halfway through, you grunt and groan a little bit further to get it done up over your head or in the back of a truck or whatever else? That's what the heart will do if it's weak. So I pointed out to her in a 15-second scan, there was at least 4 or 5 extra beats among the beating of her heart. And I said the reason it's beating extra beats is because the brain isn't getting the oxygen it wants. Now you can put a pulse oximeter on the fingertip and you can see what the concentration of oxygen in the hemoglobin, that's what you're checking when you have that little finger thing. And it might say 92, 93% oxygen saturation. That's a good indication of gas exchange in the lungs. But that's not an indicator of how much oxygen the brain's getting. One of the best ways to determine if the brain's getting enough oxygen is how the heart is beating. If the heart has a regular rate, rhythm, and tone, then your brain's getting sufficient oxygen. If there's an interruption in the rate or the rhythm or the tone, then there's a problem somewhere. And as I said at the beginning of this program, the organ that suffers the quickest from malnutrition is the heart. And most of the malnutrition that's involved with the heart in our lives today is its starvation factor. Not the fact that it's, that we're eating a bunch of stuff maybe we shouldn't be eating, though we all do. I do. From time to time, I fall off the wagon, but I try to get back on as fast as I can. But I was talking about the multiple risk factors before I realized I wasn't broadcasting at K-Talk. Boy, that's embarrassing. And the typical risk factors for the onset of some serious cardiac events. From a medical point of view, the high cholesterol, smoking, high blood pressure, diabetes, prescription drugs that serve as these various symptoms centerpieces. They're all spearheaded, of course, by the American Heart Association and the American Medical Association and local and state governments. I mean, even the federal government, even the FDA, CDC. So study results from the Cochrane Heart Group and the Cochrane Collaboration. You can go look at this for yourself at Cochrane.org. COCHRANE.org. Showed that treating risk factors was ineffective in achieving reductions in total or cardiovascular disease mortality. In other words, all those various risk factors I just mentioned, treating them with drugs has almost nothing to do with extending life. And overall deaths actually increased among the drug-treated high blood pressure group, and especially the folks with the very highest risks of heart disease. So in the end, the Cochrane study showed once again that high cholesterol, high blood pressure are poor indicators of heart disease or stroke or death in healthy people. And the Cochrane Group is a very reliable source of information. They do a lot of mega-analyses where they don't do a particular study, they study particular studies and bring them together into one mega study, where instead of studying 1,500 people, they're studying 15 million people by the time they look at all these different studies. And what they find out? Well, if you have high blood pressure and high cholesterol, and you're on drugs for these, they don't do anything about adding life. In fact, one of the interesting cholesterol studies with statin drugs was that It did not increase or improve life for women, but for men, if they were on a statin for 40 years, it might give them 2 to 3 extra days of life, if you want to put up with all the side effects during that period of time. So if you are healthy and your heart screening, healthy, we've got these health screening things going on all the time. I did a radio show on why you want to avoid those. But if you go in there and you're a relatively healthy person, but you see here's a chance at $150, $190, whatever it is, you're going to get several parts of your body checked. Heart and the blood and glucose levels, and they're going to do some ultrasounds on your carotid arteries and check various things non-invasively, just to give you an overall profile of your current health condition. So you go in there feeling pretty healthy. By healthy, I mean you're golfing once or twice a week. You do all your own yard work. You do your own home repair stuff. You're active with your significant other and the kids, or whatever else you're involved. You got a nice hobby. You try to go out in the outdoors. All the different things that you would use to describe somebody if someone asked you, well, what would be signs of health? And then you list all these things. Suppose you possessed all those things, and you go to a heart screening, and you find out your cholesterol is 250, which is normal. And you find out your blood pressure is 140/90, which is normal. Don't be fooled at this particular point in time to be taking these powerful, dangerous, usually lifelong prescription drug treatments just because you demonstrated 2 normal numbers. And this is not particularly effective in terms of reducing the risk of clinical events such as stroke and heart attack and angina, heart pain. And then around 2005, a good 20 years ago, I started wondering about the relevance of homocysteine levels, because it seemed to be, the books that were coming out about how to have a more healthy heart started talking an awful lot about homocysteine, which in the previous decade was sparsely mentioned. And so, after all, all the synthetic B vitamins would often lower homocysteine levels, yet do nothing to help heal the heart. And was this finding anything different than what I've been teaching? I now feel that lowering the homocysteine levels has little direct correlation to heart disease. But CRP, C-reactive protein, definitely has an indication. So while I use the heart sound recorder from outside the body by placing a microphone over top of the valves, we want to do blood work on our cardiac patients, because I want to know what the cardiac C-reactive protein is. C-reactive protein is an indicator of inflammation. So you can do a C-reactive protein for the entire body, but you can also narrow in on the heart. And it's the same thing as if you were looking for troponin levels. Troponin is a protein that pretty well stays inside the heart. And so if you went into the emergency room with some kind of a cardiac scare, they're definitely going to be drawing blood immediately, and it's going to go straight to the lab as fast as possible. And what they're going to look for is the C-reactive protein and troponin levels, as well as some other enzymes relative to the heart. And if the troponin levels are elevated, they know you've had a heart issue. Now, a high C-reactive protein is just kind of an ancillary indication. It's not enough by itself. In some cases, it can help diagnose inflammation, especially if you're having inflammation of the coronary arteries. But it's probably not the major risk factor that up till now has pretty well been the case. We really want to see what this is. So taking all the tests, and getting all the counseling, like following a low-fat diet, taking drugs like statins or a blood pressure drug, and now they have combo drugs. That's a statin and a blood pressure lowering drug in one pill. They don't do a whole lot. They can even hurt you. Instead, it's back to basics. So when we do a heart scan on somebody, and that has to be scheduled, because it takes, plan on a half an hour. You don't have to undress. Just wear something thin over your chest, something thin fabric. And for ladies, you don't want to have an underwire bra. Wear a different kind of a bra, but not one with an underwire. It has a way of conducting vibration that shouldn't be there. And you would call the office, 801-523-1890. Say, hey, I heard Dr. Jack on K-Talk, and I think I want to schedule that heart scan. And based on the outcome of that heart scan, I'm going to suggest some supplements. And then we're going to schedule you for 30 days to do another test. And I guarantee, if you follow religiously what we tell you to do, following your scan results, you will see improvement in that scan within 30 days. That's how fast the heart will respond to improved nutrition. And so, and then we just tell you, get back to business, back to basics. Eat whole foods, not partial foods that you get in the grocery store. Eat whole foods, the whole thing that Mother Nature made. Exercise, drink clean water, keep a positive attitude, and take these phytonutrients that we recommend. And this is going to be a hard pill to swallow for most of the medical profession. I mean, the screenings and the interventions and the drugs are critical to their ongoing practice management, their patient management. They can't manage you as a cardiac patient without these drugs, because then they keep looking for the changes in the body as a result of using these drugs. What's happening to your blood pressure? What's happening to the fibrillation that is showing up, or the arrhythmias? Excuse me. But there are thousands of well-meaning physicians who honestly believe that a cholesterol-lowering drug should be prescribed for every American over the age of 50. So just this week, a lady that we take care of went into the hospital for some exams not related to the heart. And while they're checking her blood, her cholesterol was over 200, and they get all panicky. And they gave her a prescription for a cholesterol-lowering drug. And she asked me if I thought she should take it. And I give the standard answer. If I tell you what I really think, I could go to jail or lose my license. If you were my wife, which is what I said to her, if you were my wife, I would greatly encourage you to review the science regarding cholesterol and statin drugs, and then make your own decision. I said medicine usually runs 40 to 50 years behind the research. Most of the cholesterol statin relationship research that's coming out now shows that cholesterol, but the statins have no effect whatsoever on improving life or extending life. Now, some of these medical myths, and I hear these all the time from patients. I've got 8 of them here. 8 of the more common medical myths that because people do not take the time to research, and with the internet today, you have a lifetime of reading good peer-reviewed research. You just have to know where to go. And now, the artificial intelligence is so good, it will do most of your research for you. And it will tell you where to go look and read the reports yourself. And if you've never read a medical research paper, it can be a little confusing until you've read a few of them and you begin to see a pattern, what's going on. Starts off with an abstract that just gives you a general idea of what the research is about. And then you go through the design of the research, how they put it together, what they're looking for, how they tested it, how they tried to make sure the information was unimpeachable because they controlled the study groups and the various study groups closely, double-blind, randomized, placebo-controlled study, crossover, that kind of stuff. And then it gets to the conclusion. And it's easy to read the conclusion. This is what we found. And then there'll be some numbers that aren't the easiest things. But once you go through 2 or 3 of these, and then there are videos on the internet, on YouTube, on how to read a research paper and how to make sense out of it. And without taking the time to do that, you're at the mercy of the profession that wants to sign you up to the club with at least 3 or 4 drugs for the rest of your life. So some of these classic myths, like taking an aspirin every day will help you live longer. That's not what the science says. In fact, more and more the science now says not only is that ineffective, it's dangerous because it can lead to stomach and gut inflammation and gut problems. The myth that low carbohydrate diets are unsafe and that they're ineffective for weight loss. What they really did when they came out hard against the Atkins diet when it first showed up. In the cholesterol thing I'm talking about, nearly everybody would benefit from taking a cholesterol lowering drug. Absolute myth. Nearly everyone over age 50 should be taking blood pressure drugs. Nonsense. Right into the 70s, which is, about 50 years ago. Even in the Merck manual, high-end blood pressure was your age plus 100. Keep the diastolic, the lower number under 90, and then the high end of normal would be your age plus 100. So that would, for me, would be 175. If I could keep my blood pressure under 175 over 80 something, I shouldn't worry about it. Well, there were too many people in that category who actually were not having heart attacks. But it opened up a whole new market for blood pressure lowering drugs when papers sponsored for and study research, paid for and financed by pharmaceutical companies, started saying, no, your blood pressure needs to be under 150. No, your blood pressure needs to be under 140. Oh, no, now it needs to be under 120 over 80. Oh, no, now it needs to be down around 110 in the 70s. And at every new publication that comes out, when you read these reports, it usually tells you who's sponsoring it, who's paying for these results. And medical researchers are bought and sold every bit as much as our politicians are. So, you have to look at who's supporting what. Stephen, when I think of cholesterol and statin drugs, I remember the book Lipitor, Thief of Memory. I think Dr. Jack is where I first heard of that. Yeah, great book. Still, you can go to Amazon and get it. Lipitor, Thief of Memory by Dr. Bruce, or Dwayne, is it Dwayne Graveline? Dr. Graveline, who was a cardiologist to the astronauts. And they won't let an astronaut go into space unless their cholesterol is over 300. I'm serious. Because your brain can't work without it. And you look at the explosion of dementia that's going on in this country, the absolute explosion of dementia, and the explosion of people on statin drugs robbing their brain of necessary cholesterol, not just the essential fatty acids, EPA and DHA and the other acids, fats, but cholesterol. As I've said many times, your brain by dry weight is more than half fat. So what was the last one? Anybody over 50 should be on a blood pressure drug. All radiation is dangerous unless administered by oncologists. That's not true. A study that came out of the University of Washington. You remember it was 5-6 years ago, and all of a sudden, in dental chairs, they stopped laying lead vests over you. It wasn't necessary because they found, radiation, X-rays are coming out of the earth. It's called background radiation. There's background radiation coming from the center of our galaxy that's bombarding the earth every day. There's X-ray radiation coming out of the sun that's bombarding us. And so you grew up with this stuff. And until you get to the point where you're doing multiple X-rays, and I mean lots of them. I mean, one good diagnostic CT scan of, say, the lungs for suspected cancer or something can have over 600 X-rays that makes up that image. But they're very low dose X-rays. Now you add them all up and yeah, it's a little higher dose, and you don't want to be doing that every day. But short of that, boy, though, the alarm is off on the X-rays. The X-rays that I do in my clinic, because I have no idea what to do for a patient without X-rays, are a less dose of X-ray than you would get in the dentist chair. So, another myth, annual mammograms and follow-up treatments will prolong your life. That's not what the research says. The research is saying it increases your risk of breast cancer to have a mammogram. So when I talk to a female patient who's asking me if they should get a mammogram, or they tell me they've had a mammogram and there's this little tiny spot, yeah, you're going to find a little tiny spot. That's not unusual. Let's see if that spot's there 6 months later. There's research that shows a lot of these little spots, these little points of interest, 6 months or a year later are gone. They're not there anymore. So some cystic thing took place, and then your body got rid of it. But you're subjecting breast tissue to intensive X-ray in a mammogram. It's not, just having the life squeezed out of your breast when you get one of these things done. It's being bombarded with X-rays. And then they're not, usually it could lead to a lot more invasive testing after that. Am I telling you not to get one? No, I'm telling you to study the research. Cancer treatments are better than ever with cure rates of over 60%. I heard that not too long ago. BS. That's not true at all. In fact, cancer is exploding again. Some people are blaming it on the COVID vax, the turbo cancers. Water fluoridation prevents tooth decay and is perfectly safe. These are classic medical myths, and they become malignant myths when they're prolonged for more than 15 years. And most of these fit that definition. Yeah, I'm sorry about that. Thanks, Paul. Thanks for keeping me up to date. All right. I'm still talking about the heart here, and I highly recommend the heart sound recorder. You want to get somebody a decent Christmas present? It costs $100, and you're going to get an education on your heart that you're not going to get anywhere else. It will show you things an ECG or an EKG can't. The typical heart scan in the emergency room is based on electrical signals. And so if you go into the emergency room with chest pain, not only are they going to draw your blood and start looking for enzymes, they're also going to do an EKG. They're going to put the little leads on you and watch your heart in real-time function electrically. And if you have had a cardiac experience, even the smallest of heart attacks, it leaves scar tissue behind. And it's the presence of scar tissue in the myocardium, the heart muscle, that interrupts the electrical signal that's being passed through the body, and the software interprets it and shows it as an alteration of the QRS wave or the QRST wave, so that a cardiologist can look at it and see, yeah, here in the heart, you've got a problem, which of course will open the door for much more testing, which in some cases definitely justifiable. It's just that the symptoms are going to be addressed with drugs rather than nutrition. Now, with the heart sound recorder, it's looking at auscultation. Auscultation is listening. When a doctor puts a stethoscope on your chest or your back, that's auscultation. That's been around for 300 years. The French really developed good auscultation technique. I was reading back in September, I was reading a medical report that said the beauty of the art of auscultation is being lost because of digital sounds and having computers interpret sounds instead of human beings. And the heart sound is still the best indicator of heart function, better than an EKG. The EKG showed up in America from Germany, and it showed up about the time when heart disease wasn't all that big of a thing, just after World War I. It was only beginning to show up. And in fact, there were some reports that were written up in New England that was telling this German fellow who brought it from Germany, you might as well take it back to Germany. We don't see any relevance for it. Well, shortly after that, not too long after that, the heart sound recorder was developed by Dr. Royal Lee. And listening to the function of the heart, rather than reading its electrical activity, was much more conclusive in the current condition of the heart. And that's what we have with the heart sound recorder. And so it takes, we read each valve for about 15 seconds. It's on the screen in front of you. And then we show you what your scan looks like compared to normal scans. And you can see right away how close you are to normal. And then, as I was saying in the beginning of the show, 30 days on a program that we recommend usually involves 2, maybe 3 supplements. You take them religiously every day. Watch and see how your heart improves in just a 30-day period of time. But it's not just how it appears on the heart sound recorder. It's how you feel. The fatigue begins to disappear. You can walk up a flight of stairs without being lightheaded. You don't have to do it 1 step at a time. You can take 2 steps at a time. Why am I hitting this? Because this is the #1 killer in America. And odds are between now and January 1st, somebody you know is going to die from a heart attack that didn't need to. All right, now a little bit about irregular heartbeats. That's another question I get. You know, and what about a cardiac aversion or ablation treatments where they actually burn the heart muscle? You know, what do you think about these kinds of things? Again, you're treating the symptoms of malnutrition. You're using chemical poisons, drugs, and invasive therapies to address the symptoms of starvation, as Dr. Lee said. Now, if you have an irregular heartbeat, which is what an arrhythmia is, and your doctor said that you need powerful prescriptions, you need cardiac shock treatments, cardio aversion, burning of the nerve endings in the heart muscle, cardiac ablation, you need to know something here. Because at least one of you listening right now, even though it's a lower audience because the tower's down, at least one of you has heard this in the last month from your doctor. And the drugs used to treat this condition that I just described are very powerful, and they are debilitating. They will turn you into what I refer to as a cardiac invalid. You're not want to do anything anymore. You're not going to want to get off the couch or go anywhere. And they do not do a very effective job of controlling the situation, and they all carry strong side effects that can be even worse than the arrhythmia, which is the reason they gave you the drug. And as for shock treatments, it rarely, if ever, works for the long term. It's not unusual for a patient to be shocked into rhythm a dozen times, ultimately ending in failure. And ablation, for all its drama, is not a whole lot better. Ablation is where they'll go up through the arteries and into the heart with a little device that burns the muscles, the nerves in the heart muscle in certain areas to slow the heart down or to make it pump less effectively to drop blood pressure, with this idea that elevated blood pressure is a killer. Now, blood pressure over 200, yeah, that's an emergency situation. You won't get any argument from me on that. But since drugs are not really effective, shock doesn't work, and cardiac ablation surgery rarely works for the long term. You might think that the heart experts would be looking for some other type of treatment. But without looking for the real underlying cause of heart arrhythmias, no other treatments will ever be forthcoming. So if you have an irregular heartbeat, you're going to be treated with these therapies I just mentioned over the months, over the years that follow, almost always ending up in the same place right where you began, because it's not addressing the problem. This is particularly disappointing to the naive patient. I mean, if that patient is you, you might be convinced that the treatment, especially ablation therapy, surgery, is ultra high-tech, ultra dramatic, and absolutely cutting edge, and your hopes are going to be high. You're going to feel good knowing that you're getting the most up-to-date cardiac care in the entire world from the #1 leading heart health center in your state or whatever else. And your hope, I've seen this. I haven't had an ablation. I doubt that I ever will have one. I've just seen this in my patients, who I start taking care of after they've had these heart therapies. And what happens, the hope goes out the window when their heart snaps right back into the same arrhythmia soon after the treatment, but you'll still have some high hopes when you're introduced to the next step in treatment. Cardiac surgery will surely cure your abnormally beating heart, they say. But soon you become aware that you've gone through hell, you've spent tens of thousands of dollars, suffered just remarkable side effects, and even had your heart potentially damaged from all that burning, all to no avail. You know, a wise man once said you cannot expect to have things change when you keep doing the same thing. When your lifestyle is of such a pattern and you do these extra cardiac therapies trying to make up for what you've lost in your lifestyle as far as health quotient is concerned, and you don't do anything to change your patterns, your choices in your lifestyle, it's insane to think anything's going to change. But we want that miracle drug, don't we? We want that miracle pill that allow us to go on violating the laws of nature and nutrition, because this super powerful pill is going to allow us to continue to eat all these highly processed foods, go on smoking, go on drinking, go on with our high sugar diets. But that's exactly what goes on with this kind of a problem. Yeah, Sparker, you heard me talk about this last month. This is great information. You need to come down for a test. Yes, I'm telling you, you'll be surprised. You'll be surprised when you see your heart, what your heart function really is on this test. But you'll be even more surprised what happens 30 days later by following the therapeutic program of supplements. Not synthetic supplements you get in the health food store. The stuff we use isn't sold in the health food store. The majority of what's sold in the health food store are synthetics. Now these, I mean, just why a smart physician would do the same thing over and over and over and not consider that the same result usually ensues is difficult to understand. Just think about that. These doctors that administer these tests, they know what's going to happen. And it's a step-by-step pathway to get you into cardiac surgery, maybe valve replacement or something else. And these doctors are trying their very best to do the right thing to help you. No doubt in my mind. But to really accomplish this, they have to start thinking outside the box. That means thinking of some alternative form of cause and treatment beyond what they were taught in school and what they are currently allowed to do by the health board. And when you consider the treatments are the current menu of treatments are considered the gold standard in medicine, and since alternative treatments and straying away from the gold standard is just considered witchcraft, to put it mildly, really good, effective alternatives are just not going to happen. And then add to this mix the fact that the powerful pharmaceutical industry does not want doctors thinking outside the box. After all, when you have tens of thousands of people as members of the club signed up for lifetime prescription drugs, I mean, that's such a powerful incentive for these companies that they want to keep their doctors in line. And it is the recipe for doing the same thing for years, even decades. Now, if your doctor's treatments have failed and he or she is scrambling to do something else without thinking outside the box, you need to start thinking for yourself. And as I said earlier, the information is there, it's available. You just have to know where to look. So you get on the internet, or you can use ChatGPT and use it to help you start studying and looking. But it'll tell you some really good stuff. I've played around with it myself. In fact, I'm quite impressed with what ChatGPT does. Now, I have a large portion of my patients are computer people. And I've asked 2 or 3 of them that are, they're either coders or they write software. And I asked them, what's the best AI out there right now? Because there's a mess of them. You know, Elon Musk is really pushing Grok right now. And they usually have the same opinion. ChatGPT is still the leader. Now, some of the other AI systems have a particular specialty that they're good at, in the sense of graphics or music or writing or research or whatever else. But for overall, the best was ChatGPT. Now, there are many causes for an abnormal heartbeat, and that's one of the things the heart sound recorder picks up. Some of the most common ones are cardiac and blood pressure drugs. Eye drops for glaucoma can cause cardiac arrhythmias. And a whole host of other drugs, from thyroid drugs to over-the-counter cold medications, pseudoephedrine, things like this, can cause arrhythmias. Why? Because any of that stuff is going to get in the blood. And the first organ to get stuff that gets through the gut or the lungs into the blood after it goes through the liver is the heart. And anything that the liver is designed to stop and filter out depends upon the health of the liver. And the older you get, the more you've eaten the standard American diet, the more plugged up and toxic the liver is, more this junk is going to get through into the bloodstream. And the first one to get fed this stuff is the heart. So even all the over-the-counter stuff, and this is where Tylenol comes in. The big hullabaloo about Tylenol lately, about autism and other kinds of problems related to autism or to Tylenol. And of course, the jury's still out, but the jury will come back here before too long. And you'll find out, and I had a conversation with a patient about this who was pregnant. And her previous pregnancy, the baby was allergic to her milk. And I said, all right, I want you to think about this for a minute before you walk out of here believing that your baby's allergic to your milk. There's something in your diet that's getting in your milk that's causing a sensitivity to the baby. It is as impossible for your baby to be allergic to your milk as it is for your baby to be allergic to oxygen. But there's something getting into your milk that the baby is sensitive to, not the milk itself. Now, when I talked to her about her diet. And let's review some of the things that you're eating that could be getting into your milk. Now, at the same time, it kind of hit me at the moment when I'm having this conversation with her. Gosh, what are the things we're eating that could get into the heart? Let alone into breast milk. The heart's going to get this stuff too. The brain has a barrier to protect itself from most of the garbage that's in our diet or in the air we breathe or the fluids that we drink. But the heart doesn't have a protective shield. The heart's going to get what you're eating. And what is feeding the heart muscle right now is what you ate the last 24 hours. The candy bar, the M&Ms, the donuts, that kind of stuff. The seed oils from the French fries. This is what's going into the heart. That's bad enough. But when you fill your belly with these foods that are deficient in the micronutrition the heart gets, not only is it the heart being fed poison, it's being starved to death of the micronutrition that it needs. People shouldn't get out of the 6th grade without knowing this stuff. So, by far, in my experience, the most common cause of heartbeat abnormalities is simply nutritional deficiencies and the imbalances that cause. You see some of these supplements that are advertised in the marketplace. Qanol pushing their CoQ10 or something like that, or nutrition is to come to you like a cornucopia. It's to come to you in a bundle of foods. It's not just, we get this idea that if we're backed up and constipated, let's just eat some prunes and then everything will be okay. And for some people, that fiber helps them. Other people, it doesn't. But you end up concentrating on the prunes rather than the cause of the constipation. And so you are oriented towards being taken away from the cause of the problem to a therapy that works. And because it's Mother Nature's prunes, then it's a good natural way to address it. Yeah, I agree with that, but let's find out why you're constipated. Now, if you're having irregular heartbeats, yeah, there are drugs that you can take that will level that out and start to make things a little bit better. But let's find out why you're having irregular heartbeats. So there is a remarkable protocol. And if you were going to get a heart sound recorder, I'm just going to jump ahead. I'm going to give you the protocol. I'm going to give you the protocol right now. I still think you should get the heart sound recorder so you have a baseline indicator of current heart function. And then test you 30 days or 60 days or even 90 days down the road following this protocol, where not only will you feel greater strength and stamina and less fatigue, you can see it in a scan that the heart is working better. So 1, 2, 3, 4, 5. Usually I just recommend 3 things. I'm going to recommend 5 things. If you don't come in for a heart sound recorder and you have a family history of heart disease, don't be caught up in the fact that your family is cursed with heart disease. Your family grew up at the same dinner table as children, as teenagers, even sometimes into your early 20s. You all ate the same foods, so you're all suffering the same level of malnutrition. Then some of you, after that, the light turned on in your head, and that you should be eating something other than breakfast cereal, one of the worst foods you can eat, and that you should exercise a little more, drink cleaner water, get better sleep, cut some associations with emotional vampires, get them out of your life, lower the stress levels, and your heart works better as opposed to other people you grew up with that haven't changed anything since they were children. And so you might avoid heart disease longer than they might. But the fact remains, unless you're getting foods that are critical for the heart, you know how they treated heart disease 150 years ago? Whenever they found it, because it was very rare, you would eat heart. If you're having liver problems, you would eat liver. If you're having kidney problems, you'd be eating kidney pie. Why? Because the growth factors that stimulate the stem cells that are loaded in these organs that are waiting for the genetic trigger for that stem cell to become a liver cell or a kidney cell or a heart cell is in the food of that organ. That's so simple. So write this down. Now, for those of you listening to the stream, this is being recorded, and it'll be there at the end of the program. But something called Cardio Plus. You're going to take 9 of them a day, little brown pills, 3, 3, and 3 throughout the day. Cardio Plus. If you can think of heart muscle that you would eat, and heart interestingly enough, is very tender and very sweet. It has a sweet taste. I've had heart. I've had where we've taken heart and sliced it in 1/4-inch slices and fry it up in a little bit of butter. It's actually sweet. 9 of those a day. Cataplex B Core, that has the vital vitamin B4 in it. The anti-stiffness factors, but the vitamin B4 that takes the chemical energy in your food and turns it into the electrical energy that the heart requires. And the heart requires as strong a spark as the spark plugs of a $300,000 automobile engine require for optimal power and fuel economy. Bam, bam, bam. A lot of times, because of the deficiencies of certain parts of the B vitamins, you get a very weak spark in the heart. And the electrical signals to the heart come from both the sympathetic and parasympathetic sources. And they attach to the very top of the heart in 2 different places. And they create the electrical signal that goes down through the middle of the heart to cause both the right and left ventricles to pump at the same time. The left ventricle is pumping blood to the body. The right ventricle is pumping deoxygenated blood into the lungs to pick up oxygen to come back to the heart, to be pumped out of the left ventricle and into the aorta and to the body, oxygenated. It takes a certain fraction of the B vitamin for that to be very strong, so that your heart is constantly supplying the brain with the oxygen that the brain needs. And you know that I've seen varying factors anywhere from 25% to 30% of the energy consumed in the body is consumed inside the brain. Little 4-pound organ can eat up as much as 25% of the energy of your body. So Cardio Plus, about 9 a day of them. Cataplex B Core, 6 to 9. Then Cataplex F, which is essentially fatty acids. If you ate deep ocean fish or a lot of sardines, things like that, 3 times a week, you wouldn't need Cataplex F. About 6 to 9 a day of those. And something called Mintran. As many as 9 to 12 a day of those. These are just little tiny pills. It has the essential minerals, the micronutrients that are necessary for good, smooth heart contraction and strength. And then on top of that, something extra that I'm using is flax oil B6. I take 4 a day of those to make sure that my heart and my brain are getting the essential fatty acids that they need. Now, there are indeed many causes of cardiac arrhythmias, but by far, and I know this because we can show the elimination of cardiac arrhythmias on the heart sound recorder by following these nutritional therapies. So the number one cause of arrhythmia, and the American Heart Association not only is not going to talk about this, they don't even know it. The number one cause of heart arrhythmias is malnutrition. So you want to treat your heart nutritionally before you embark on a lot of costly, dangerous, risky medical heart therapies. Now, if you're kind of at the end of the road and you have a massive heart attack, well, yeah, you're on their territory. You're going to follow their program at this point. What I'm talking about is things that can be done in advance. And I'm telling you, after 3 to 4 months of this kind of therapy, I guarantee it, after 3 to 4 months of this kind of therapy, as provable on the heart sound recorder scans, you're going to see definite and feel definite improvement in your strength, your vitality, fatigue levels, even sex. Ooh, did he say sex? Well, now I'm interested. Now, there is no longer any doubt that infections, and we're seeing more of this because of the COVID, what time is it? We're seeing because of the COVID vaccines. There's no doubt that infection and inflammation in the inner layer of the blood vessels can cause disruption of blood flow and potential clots and result in stroke and heart attacks because of the intima being affected by inflammation or infection. And it all started with a lowered, altered immune function. But interestingly enough, a decrease in your own immune response to these types of antigens or invasive elements are, again, nutrition dependent. Now, in all the people that I've talked to, and then other probably untold millions whose immune functions are suffering due to immunosuppressive drugs like prednisone, because I have these patients who come in and they say, well, I didn't want to get on prednisone, but my doctor told me I had to. And I said, what do you know about prednisone? And they usually have a good idea about it, but it's immunosuppressive. It suppresses the immune response. And diminished immune function can slow the white blood cells in their protection against microbes, germs getting into the inner cells of the blood vessels, and the bacteria, fungus, viruses are the prime culprits. And we know that viruses can cause massive inflammation to blood vessels. Herpes, mumps, measles, lymphoma, flu viruses, cytomegalovirus, adenovirus, poliovirus, several others. And you have the seeds of all these diseases in your body all the time. You can't escape them. Every disease known to man, you have vestiges of those diseases in your bloodstream right now. You can't escape them because you live in an ocean of these viruses. Interestingly enough, when the first announcement of COVID-19 back in the late part of 2019 into 2020, as soon as it was suggested, theorized, that this wet market in Wuhan, China, and whatever animal, and they went through several different animals, spreading this viral agent, 2 weeks later, They found this viral element in the snows high in the Alps in Switzerland. 2 weeks later. How did it get there? Did an airplane land up there in the mountains? No, the winds carried it. There were more than 10 to the 31st power. That's more than stars in the known universe. 10 to the 31st power of viruses in the air. 10 to the 31st power of viruses in the earth. 10 to the 31st power of viruses in the oceans. You can't escape this stuff. It's around. You live in a sea of viral elements. And then combined with the fungi and the bacteria and parasites and other microbes, you live in a community of these things. And what keeps them at bay and what keeps you healthy is a strong immune system. So, can infections cause heart attacks and strokes is the question. Well, when you are dealing with serious inflammation, if you follow the medical route, you're probably going to get on prednisone. And prednisone is like, if you're some bad guy moving into a neighborhood, you would love to be able to round up all the police and put them in jail. So as the bad guy, you can go on about your burglaries. That's kind of what prednisone does to the white blood cells. And a viral infection can produce an irregularity in the smooth lining of blood vessels. And this will disrupt blood flow, creating a turbulence in that area. And we all know that platelets can be disrupted, which causes the body to release the enzyme thrombin. And then thrombin ends up producing fibrin, which adheres to the area of the inflammation, like a patch, and burying the viruses or the bacteria below that patch that have a way of getting into the lining of the blood vessel. And most of these microbes are anaerobic. They thrive without oxygen. So they can easily become invasive when buried in this low oxygen atmosphere and glued into the blood vessel under fibrin, cholesterol, and other substances. And then to make matters worse, as the fibrin is all used up, the body introduces more into the total circulation, resulting in thick or sludge-like blood. And this is the perfect environment for further inflammation and clots. I mean, it may even be the reason for so many heart attacks and deaths following smallpox vaccinations. Smallpox and other vaccines cause a low-grade infection, which could then start the thrombin, fibrin, sludge blood phenomenon. And most vaccines are live viruses: smallpox, measles, mumps, rubella, polio, chickenpox, attenuated, weakened. But I always think it's cute when they talk about live viruses versus dead viruses, when if you go to the CDC, cdc.gov, and search viruses, and go to the introductory page on viruses, the first paragraph, the first sentence of the first paragraph: viruses are non-living entities. I wonder if virologists know that. Well, now that, when these small vessels get occluded, and this is what the D-dimer test is for, and it started getting really popular after the Pfizer and, the other vaccine. You know what I mean. Would cause microclots in these tiny little blood vessels. And the D-dimer test is the one that reveals that. And then that kind of sets up, it severely limits the body's ability to deliver the immune system. And then you end up treating the symptoms, leaving the underlying cause to get worse. And people and doctors, and some of the patients I took care of, laugh when I told patients that their heart problems might be due to an infection. Well, not any longer. Treating the whole patient from improving immune system function to supplying nutrients to support blood vessel windings is critical. I mean, how do you know if your problems are caused by blood vessel inflammation? Now, the liver produces a marker when blood vessels are infected and inflamed. It's the C-reactive protein I was talking about in the previous hour. Where are we time-wise? Got about half an hour. So if you're having heart blood vessel problems or stroke problems and your CRP is high, and this will be in your blood test, you can count on the fact that you're suffering from viral and other microbe inflammation of the blood vessels. And then you in turn will also have this sludge-like blood with all the ramifications that go with that, elevated blood pressure, one of them. And in this case, you have to treat the whole body, including nutrients for the heart and blood vessels, with specialized nutrition to quell the viral and microbe inflammation. Now, there's something that I take 3 of a day. It's part of my breakfast. Something called Cyruta Plus. It's this bioflavonoid phytonutrient complex made from buckwheat. And so I take 3 of them. And the dose is usually 3 to 6 months. You want to monitor your success with follow-up CRP blood tests. But naturally, this is in conjunction with your heart and blood vessel protocol I've already talked about. So if you have high fibrin blood with sludge, inflammation, and bumps and clumps in your vessels, standard holistic therapy for heart disease is as futile as aspirin or cholesterol-lowering drugs. Lots and lots of ascorbic acid and vitamin E will simply not clean out the blood vessels. You can take my word for it. Or you can suffer through months of therapy trying to do it chemically. Now, I don't want to say treated, having counseled with many patients on phytonutrient protocols, I think I've gained quite a bit of experience in this field. And experience has taught me that the failure of medical heart care can be summed up in one paragraph. The patient who is dying of heart disease does not and will not believe that certain nutrients are necessary for heart function and repair. They will die, and the doctor will say, hey, we did everything possible. We did everything modern science makes available today. We did everything we could. And unfortunately, the doctor does believe that. The doctor believes that she have done everything that they know to do for the betterment of your health. And sadly, this ignorance is absolutely omnipresent and will be for the foreseeable future. I mean, even the patient who's died will never have known that modern medical education will make this a certainty, because that is all they're taught. Remember back at the beginning of Bobby Kennedy Jr.'s career now as Secretary of the HHS, and he told the medical schools, I don't know, I haven't seen any follow-up to this. I don't know what's happened since. But until they start teaching classes on nutrition, they could be depriving themselves of needed federal funding for their medical school. You want federal dollars? Start teaching nutrition. Boy, imagine that. Because the current medical education system simply produces physicians who will never know that the heart has to be nourished. Therefore, the underlying cause of most heart disease remains ignored and untreated, and but we've done everything possible. Boils down to using drugs and surgery to manipulate symptoms simply caused by nutritional deficiencies and imbalances that continue right up to the patient's death. Now, how long has this gone on? The kind of condition and in medical schools that I'm describing right now, how long has this gone on? Yeah, you can go back to Rockefeller. I have a list here of some clinically proven data that can shed some light on this sad state of affairs. Long ago, researchers stated unequivocally that when it comes to research and successes related to nutrients and heart disease, they said this, quote, "Developments have been taking place so rapidly that one not making a special effort to keep abreast of the new findings will be amazed at their significance." Here's just a few. Absence of certain B vitamins leads to heart block and remarkably slow pulse. That's what their research is showing, especially vitamin B4. You can't go to the drugstore or the health food store and get vitamin B4 because the CDC or the FDA says B4 doesn't exist. It does. It's part of the anti-stiffness factor. The research that discovered vitamin B4 was when research was done on pigeons. And some of the pigeons that were brought in for the study, during studies, lost their ability to fly. They just ran around on the ground. And so research was done on their feed, as that was the first suspicion. Imagine that. They thought the pigeons' inability to fly was based on what they weren't getting in their diet, as opposed to immediately trying to blame it on some virus or some gene defect. And as they experimented with different foods, they were able to finally find a certain element of whole grain, unprocessed whole grain, that contained this factor. And since they had already identified thiamine and riboflavin and niacin being B3, they named it B4. And when they put that back into the diets of the pigeons, suddenly they were flying again within a few days. That's what's in Cataplex B Core, that that specific vitamin nutrient, in addition to all the others I've been talking about. Another one, deficiency of the whole vitamin C complex, which is not ascorbic acid, mind you, results in, among other things, physical weakness, shortness of breath, rapid respiration, rapid heart action, and a tendency to disease and inflammation of the blood vessels and the heart. Where do you find the whole vitamin C complex? I take 3 of them every morning, Cataplex C. Read the ingredients, all the foods that are listed there. This is why ascorbic acid will not cure scurvy, but lime juice does. That's why the British sailors were called limeys, because whenever they'd go to sea, they had to have an adequate store of limes. Because if these seamen the British seamen did not get the juice of half a lime every other day, they would get scurvy. Scurvy is where you have blood vessels breaking down, just tremendous fragility. And so it shows up in the gums with bleeding gums. But you can get scurvy in the heart. You can get scurvy in the lining of the gut, where due to a deficiency of whole food vitamin C, the whole vitamin C complex, blood vessels break down. Another one, heart valve involvement arises in many cases from infection or inflammation. The organisms may have a special affinity for heart valves and may produce organic diseases of the heart. This susceptibility and low resistance is largely a result of a vitamin A deficiency, which is also known as the anti-infective vitamin. So anytime we're dealing with infection in the lungs, infection in the skin, infection that's gone on longer than it should, we always get our patients on whole food vitamin A, Cataplex A, especially if it comes to the lungs, because it's absolutely essential in marker for immune response, but also for very healthy epithelial cell formation, the cells that line the surface. Another one, and vitamin B deficiency is known to produce loss of appetite through its effect of causing a loss of tone of the stomach wall muscle. This loss of tone may affect the heart and muscular walls of the blood vessels, resulting in heart weakness, edema, and heart failure. Yeah, exactly. That's why we use Cataplex B when we're dealing with the heart, because it has those factors that strengthen heart muscle contraction. Now, all this is stemming from what I talked about in the first hour relative to the heart sound recorder. Takes about 30 minutes. You don't have to undress. The only issue is don't wear an underwire bra. Wear a regular bra. The underwire can affect the transmission of the signal. And something thin over the skin, nothing thick. And we just lay this microphone over the valves, 4 different places around the heart. And then we listen to what the valve is doing. And if the valve is weak, if the valve is sick, if the valve has some dysfunction going on with it, it's going to show in the scan immediately. And the beautiful thing about it is after 30, 60, 90 days of this protocol that I've been talking about, you'll see a change. You'll see a change in the strength of the heart, but not just see it, you will feel it. All right. Another one. The whole B complex is necessary for the proper transmission of nerve impulses throughout the heart's electrical circuit. With deficiencies and/or imbalances, you can suffer from arrhythmias, extrasystoles, heart block, atrial fibrillation, and more. And B complex deficiency results in bradycardia, which is a slow pulse. Heart block, pulse below 40. Complete heart block, pulse below 30. Sinus arrhythmias, heart beating too fast, too slow, skipping. Pulsus alternans, which is a pounding pulse with alternating weak pulse. Atrioventricular heart block, which is problems with the AV heart node sitting up at the very top of your heart. And right or left bundle branch block, and more. Just because of vitamin B deficiencies. Not the vitamin B that you would buy in the health food store. Those are drugs. If they list the vitamin by its chemical name, it was made in a laboratory. There is no vitality in it. Vitality comes from the sun, through the plants, through photosynthesis, in a healthy earth soil. And you either eat those vegetables or you eat something that ate those vegetables to make sure that you get that nutrition. Now, if we can take those vegetables in an organic form and slowly, at very low temperatures, and low atmospheric pressure, dry those things out, mix them up, stamping them to a pill, we can take the better concentrate of what Mother Nature made and put it in a pill. Is it an improvement on Mother Nature? Of course not. As patients often ask me, do I have to take all these pills? No, certainly not. Just eat better. What does eat better mean? Well, we eat better. Well, tell me about it. Well, we eat salads. Are the vegetables organic? Well, I don't know. What kind of oil is in the dressing that you put on that salad? No, I don't know. No. Eating salads don't necessarily make you healthier. If they are organic and you have a wide variety, a nice mixture of colors that are in that salad, and you're using extra virgin olive oil, and you're using some kind of vinegar to go with it that's organic, yeah, you can be benefited by that, no doubt about it. As you would be benefited by eating 2 4-ounce portions of liver a week, and thymus, and brains, and kidney that our ancestors ate, surviving on the frontier, when there were no diseases to speak of, except in some of the infectious stuff because the waters were contaminated. In 1938, we learned of the B vitamin fraction from the germ of wheat called vitamin B4. Research showed that this portion of the B vitamin was fat soluble, unlike most of the B vitamins. And this amazing nutrient was also found in conjunction with the whole germ-produced vitamin E complex. And using whole, raw, cereal germ, it was discovered that this B vitamin could cure people with heart block, just as much as it made invalid pigeons able to fly again. It was shown to quickly eliminate loss of muscular contractions in the heart. This B vitamin, B4, became known as the anti-paralytic vitamin. I take 4 of these every morning. I have no history of heart problems. My heart scan looks better now than it did 10 years ago. It still shows room for improvement. But I take 4 of these Cataplex B cores every morning. So it was absolutely critical to any person with any type of heart disease to be taking Cataplex B core. And in experiments from the 1930s, heart disease and heart block were treated with synthetic versions of a few of the cereal B vitamins, namely B1 and B2, and these tests failed miserably. Yet when the phytonutrient-rich whole food B complex from the germ of the cereal, containing all the B vitamins plus naturally occurring B4, the heart block was cured. I can see heart block. I can see heart block on a heart sound recorder scan. And it's ironic that B4 and a lot of the whole B complex vitamins come from cereal germ. And cereals today are stripped of these vitamins, and then they're fortified by replacing a few of the B vitamins with a couple of synthetic substitutions like B1 and B2. I mean, today most people dying from heart disease really eat tons of cereal and bread, all fortified with synthetic B vitamins. So they take the germ of the grain, wheat, whatever, and they take that germ out of there and the bran so that they can create white bread from it. Otherwise, they're going to have whole wheat bread. But they take this germ out of it that has the actual B vitamins in it. The B vitamins aren't in the flour. It's not in the carbohydrate portion of the wheat berry. It's in the very germ inside of it. The thing that can cause a wheat plant to grow from a kernel or a wheat berry planted in the ground, wheat will come up. But if you take Cheerios or Wheaties or Raisin Bran and put them in the ground with water, no wheat is going to come up out of the ground. Because what made that a living plant has been removed in the processing of it to make breakfast cereals or to make white bread. I can't put it any simpler than this. Am I getting preachy? I don't want to be preachy. And so vitamin B4 has been deemed not necessary for human health by the powers that be. FDA will tell you there's no such thing as vitamin B4. The American Heart Association will tell you there's no such thing as vitamin B4. And for that reason, it's never been synthesized, and so you won't find it on a vitamin label. It's only in whole phytonutrient-rich vitamin complexes made from whole foods and raw wheat and cereal germ. And the best sources, of course, are Cataplex B2 and Cardio Plus, or B Core, Cataplex B Core, and it's in Cardio Plus as well. So this brings me up to how I want to finish the program. Vitamins have to be food-based. I mean, it's easy to find the research and the clinical data that proves whole nutrition and nutrients are needed if you want to maintain a healthy heart and heal a diseased heart. I remember back in the 70s, I think sometimes in the 80s, there, the news programs like 2020, Dateline, different things like that, every now and then would have this expose on vitamins. And they would come out and they would talk about how vitamin A caused birth defects. And vitamin E would cause heart problems. And vitamin C would cause hardening of the arteries. And all those things, that was real, that was true. Synthetic vitamin A that you can buy in any health food store will cause birth defects. Synthetic vitamin E will hurt the heart. And synthetic vitamin C, which is ascorbic acid, a study out of the University of Southern California a number of years ago showed 250 milligrams a day, just 250, will cause arteriosclerosis, hardening of the arteries. So I remember when these programs first started showing up in evening TV, especially Dateline, 2020, I thought, that can't be. This is just sponsored by pharmaceutical companies, which I found out it was true. But it was wrong, but not for the reason I thought it was. I thought it was just propaganda against vitamins. No, they have rather detailed studies of the effects of these synthetics on human physiology. So it's easy to find the research and the clinical data that proves whole nutrition, whole nutrients are needed to maintain a healthy heart and heal a diseased heart, as I said a moment ago. And the nutrients most clinically significant were whole vitamins A, B, C, and E. And these were derived directly from food and were completely different from their fractions called things like beta carotene, or B1, B2, B6, ascorbic acid, alpha tocopherol, beta tocopherol, delta tocopherol. And they all failed in trials to heal a diseased heart, every single one of them. Because you can't synthesize something Mother Nature made. You can take Mother Nature's whatever, a kernel of wheat, and through wet chemical analysis, determine the chemical factors that are present in that particular food sample. And then what they do in the laboratory is they, look at this sulforaphane that's in broccoli. I wonder if that's what helps the liver to detoxify itself. Let's go into the laboratory and make sulforaphane. And so they go in the laboratory and they do a lot of experiments, a lot of different things, and they come up with something that looks like sulforaphane. But it isn't. But they build a multi-level marketing company around it. And people go on using it to no avail. Later we learned that omega-3 fatty acids and calcium and minerals, as well as another part of the vitamin C complex called vitamin P, or bioflavonoids, were heart critical. And when you take a look at whole phytonutrient products, like the Cardio Plus I've been talking, all of these are available at forbiddendoctor.com, mind you. Everything that I've talked about so far at forbiddendoctor.com under supplements. What do you find? You find the whole vitamins A, B, C, and E, bioflavonoid complexes combined with minerals, trace minerals, and vitamin activators. You can't create that in a laboratory any more than you can go into a laboratory and create a human being or something less. Let's say a carrot. Now, Bill Gates and the boys have been trying to create fake meat. How's that working? How's that coming along? Thanks, Stephen. He says I'm not preachy. I just get excited about this stuff because I see the results in my patients. And what's funny is to do a heart scan on somebody who thinks they're healthy, like this lady I told you about in the first hour. And the heart is not healthy, skipping a beat or adding extra beats or too long of a QT. Then we give them some supplements, they chew it up, they swallow it. 20 minutes later, do another quick scan. Already you can see improvements in the scan in just 20 minutes. So we've known that the heart is the most responsive organ in the body to nutritional therapy, and that a healthy heart needs a critical supply of specific nutrients, and that the whole nutritional complexes routinely can help people with even advanced or end-stage heart disease. We've done the same thing with end-stage kidney disease, greatly improving the GFR, the glomerular flow rate, with nutritional complexes to prevent them from dialysis. Same thing with the heart, critical complexes that can reverse end-stage heart disease. And how long have we known this? Thanks to Dr. Royal Lee, we've known it for nearly 90 years. Nearly 100 years, actually. So make note that whole vitamin complexes are made from whole foods. Yes, your nutritional status, frankly, it comes down to how much of your food intake is coming from whole foods as opposed to synthetics. If it's in a box, a bag, or a can, you want to be careful. But nothing has the elegance and the healing power of Mother Nature. Simply nothing. All right, that's going to do it here. I am going to end the stream, and then I'll get back to K-Talk here. I don't know how long we're going to have tower problems, but we obviously are going to continue the streams. So if you have any contact with K-Talk streams. Obviously, you're listening on one. We'll be on the stream till we get the tower running. All right. Be safe out there. Keep your wits about you.